So one of the things that I think is probably misunderstood is that when your child is confirmed that they're in remission or they are NED, no evidence of disease, which is the terminology we use with Savannah, that, the journey's over, it's great, you're done, you can go back to normal life. And unfortunately, that's not true. Nope. The doctor told us her shoes weren't fitting right and to have her wear sandals. That didn't pan out. That wasn't what was really going on. And so we ended up going to see a podiatrist, and they took some x-rays and then told us we needed to get an MRI. We thought we were going in for maybe surgery to fix a broken foot, and what ended up happening was we got a diagnosis that they thought she had metastatic bone disease. There's a lot of things that go on with a cancer diagnosis. Your life definitely gets turned upside down very quickly. We went from being a family of 5 with a newborn baby. Our youngest was 5 months old, and we moved into the hospital pretty quickly. When we did our scans at the hospital, we found out that Savannah's cancer had already spread. So it was 6 weeks from the first, what we thought was a spider bite, to finding out that the cancer had already spread to her lungs.
What did it feel like to hear those words?
Kind of scary at first, but after a few weeks in the hospital, I kind of got used to it.
Our Dr. Katzenstein told us very early on not to Google things, that her story was her story, and that statistics weren't going to define his treatment plan, or that we were going to have success. And so there was definitely a lot of emotion as a parent to deal with that and to try to cope with the thing that I never thought would happen. And he told us that our goal was, I wanted numbers. I wanted, what's the chance of survival? And he made it clear, it's 0 or 100. Either you don't survive or you do. And so we're obviously fighting for the 100%. I think the skill set and the expertise that's offered is so unique and so needed. For us, it was a huge benefit to have, a team that was kind of on our team outside of the hospital as well, outside of clinic as well. And so having Child Life be able to come into our home and have them explore what was going on, like, this is what happens to Savannah, this is what's going on, was really beneficial. It's still kind of always there, but our hospital stays ended, and we were moved to outpatient treatment for a study drug, and then now we're just doing scans and maintenance. And so helping figure out the balance of life again with how to be a family again. And the other aspects of Pedscare again have been great for us. We had a nurse who was a part of our team and came and did house visits, which was really great. We didn't have a ton of time at home between our inpatient stays, but when we did, having someone who I knew I could text if I had a question was great. For us, we currently are in the maintenance phase of getting scans every 3 months due to the aggressive nature of Savannah's cancer. And so every 3 months, the week or two before the scans are happening, we call it scanxiety. It's the anxiety of just not knowing the results and knowing what they could be. The battle's really never over. It's something that we're going to be dealing with her entire life.
Well, we are so proud to go gold in honor of you and in honor and memory of so many of our patients, past and present, and we appreciate you sharing September as Childhood Cancer Month with us.